Hello, good day. We are here on International Women's Day. Happy International Women's Day to my free panelists, as well as to all women all over the world. This year, we are celebrating International Women's Day under the theme Women in Leadership, Achieving an Equal Future in a COVID-19 World. I mean, we all know of COVID-19, we've all experienced it. We are all still suffering from COVID-19. And while COVID-19 has brought us many disruptions, much disruption, COVID-19 has also brought many opportunities. COVID-19 has provided us an opportunity to relook and revisit what is important for us, what are the priorities in our lives, and also in terms of our workplace. And so today, I am so happy to be joined by three esteemed women. To my immediate right is Mrs. Mignon Roll Shillingford, who is the head of the Health Promotion Unit, Ministry of Health and Wellness, Government of Dominica. Ms. Lucia Stedman, chairman, owner of Business Training Center and an educator, and Mrs. Catherine Riviere Gemot, the lab superintendent. This is the lady responsible for all of our results, whether it's PRC test, whether it is now our vaccines. And so, folks, really, we are so happy to have them here. So, ladies, welcome and good day. Happy International Women's Day.
Hello, good day to our viewing public, and good day to the rest of the members of the panelists, and also to you, Dr. Henry. Of course, I want to wish everyone as well, to you all and to our viewing public, a blessed International Women's Day.
Hello to the general public. I want to wish every woman on the planet viewing this a happy International Women's Day. I'm Lucia Stedman, President, CEO of Business Training Center in Dominica.
Hello and good evening to all women everywhere. Happy International Women's Day. I am Katharina Riviere Gemot, Lab Superintendent. What I do best is to give you your results for your PCR test.
Indeed, and she's doing a great job. I think when you listen to and I read about the other countries, I think the government of Dominica and the lab of Dominica has a great record in its turnaround. So I want to congratulate you, Mrs. Gemot, on that achievement and your team. So folks, we are here to talk on International Women's Day on the theme, Women in Leadership, Achieving an Equal Future in a COVID-19 World. But before we get to that topic, how has COVID-19 impacted you, personally as well as professionally?
Okay, so just like all of our women are experiencing now, of course, I have not been immune from the effects of COVID-19. So although as an individual, I have not had COVID-19 or been infected with COVID-19, but in terms of my concern, in terms of anxiousness, this sometime last year when this came about, and when we of course had our first case in Dominica, which was March 2020, there was still a lot of unknowns, so of course as a healthcare professional, of course I'm also a nurse by profession and the president of the Dominica Nurses Association here in Dominica. So a lot of things, came to mind, how am I supposed to deal with it? Because I am tasked with educating the public, giving information that is current, and informing, to make changes. How am I going to do that with the limited information? What about myself? I am a frontline worker and I am asthmatic, so I do have a comorbid condition. And then we were seeing a number of persons who have been affected the most in terms of death and having very severe complications were persons with chronic diseases. So personally, it was hard, during that time. And I had to look a lot to the Father, through Christ. Everything is possible. So he was one of my rocks. In terms of professionally, as I said, I lead a team of healthcare workers and communication persons who have the responsibility on behalf of the Ministry of Health, Wellness and New York Investment, to pass on information to alleviate the fears and concerns, or attempt to, of the public. So, my days were very long. I felt at sometimes I didn't know which day was Monday and Tuesday or Saturday, Sunday, or night or day, So, and of course, I had to be a form of support and strength to my nurse colleagues in Dominica and also outside in the diaspora, because we have a very good network and communication between our teams in Dominica and abroad. And Dr. Henry, what was happening out there. It was very hard. There were nights I cried, cried with my colleagues, yes, and at the same time had to put on a different face where I educate and inform and ask them to be the bestness to go out there as warriors. So, there were a lot of ups and downs. At this point, since we know more, and we are at a next stage, and I'm more knowledgeable about this COVID-19, I think I'd have a better position and feel enthusiastic, about us achieving herd immunity in Dominica.
And so, Lucia, in terms of how have you been impacted personally and professionally by COVID-19?
Well, personally, I have not been impacted a great lot, because I thank God that I have not had any contact with anyone who has been infected with COVID. I have been following all the necessary protocol as an individual, so I have been saved by the following of the instructions. On a professional basis, for my business training center, honestly, I see that COVID presented great opportunities for my business. Whereas in the past, I had been looking to transit my business into online opportunities, whereas in the past, I was dragging my feet to get it done because I didn't have the necessary resources. When COVID appeared on our shores, I had no choice but to just move. And because of that move to online, this has presented some great opportunities for BTC. I have seen the emergence of people wanting to do more courses, those who could not have come in the past. We are now able to offer our classes online to people who are out of the state. All of the business plan ideas I had in the past, when I wanted to target people in neighboring countries, Dominicans who migrated, especially with the high level of migration from Dominica, these people have been communicating with us because they're excited about online. We've had challenges, serious financial challenges in the past where we attempted to go online, but the mindset of the people, they were not yet prepared for that online education. But because of COVID, everybody had to get on board. So now we did not even need to invest heavily in whatever equipment. Basic Zoom made it possible for us. We face some challenges with our young people who do not always have access to the necessary tools to be able to do online. So we had that difficulty, and there are certain areas in Dominica where people are not able to have access to internet. So some of these people spend a lot of money on the data aspect of it in order to attend classes. These challenges, as the institution, we face those challenges because we started losing these clientele. But as of late, I've seen that the telecom providers have made a great improvement in reaching the different outreach areas in the communities, and we've seen improvement with our clientele, and we are getting a new type of clientele. Although we continue to maintain our face-to-face interaction, which is important for the clientele that we attract. BTC is home to anybody who did not complete high school and require that special environment to get a second chance at education. So we've had to maintain our physical presence instead of going wholly online, so that we cater for people who require face-to-face interaction. But more and more we are seeing a better future as a result of COVID, and I'm able to report that. And I give God thanks for all of that. I said that had it not been for the prayers in the past years, I believe in prophecy, and the prophecy for this year really was about the hardships that we faced in the past. This is the experience God is going to use for us in 2021. So whatever we felt we were going through that was too much for us to handle is actually what that is going to take us through and work for us. So all of my financial burdens in the past, I see that everything is going to work out because of the opportunity for online education.
Thank you. And Mrs. Rivia Gemot.
From the professional standpoint, when we started hearing about COVID-19, that is way back in 2019 when there were issues in China, we had already had our platform for PCR. And that really put us in a good position. We were ready in the sense that we had the equipment, we had reagents, we had a professor who was already working with us, a virologist from Pan American Health Organization. We were working on other diseases, identification of other diseases. So we were ready. And I mean, it was really eye-opening when we noted that we were one of the only OECS country who was ready to do PCR testing for COVID. And so, while I say that we were ready, the challenges that I faced as a manager was the fear factor. We had a lot of persons who were very scared in terms of, and that was, you know, it was in keeping with everything that was being said about COVID. And to be able to calm their fears and get them to relax and do what needed to be done. I think it was a challenge, but from the time we got to that phase where they were calm enough to do what was supposed to be done, we hit the ground running. And you've seen the results. From a personal standpoint, I felt concerned about my home front. What was I taking to them? I had to educate myself about COVID-19 quite a bit. The late hours at work had the potential to affect my family setting. I think I got a lot of support on the home front, and so that settled quite a bit. At this point, I must say that fatigue has set in. We are all tired in the Ministry of Health, I can tell you. And so we know that we've done a great job. We know there's a lot more to be done. But a break is deserving at this moment.
I hear you loud and clear, Old Maxil. I hear you loud and clear, Mrs. Revere Gemma, that you are tired. The staff of the Ministry of Health, the lab technicians are tired because you have been at it from even before. And I really want to commend the lab, the Ministry, and the government by extension on that preparedness. And a question kept popping as you were saying that. What made you all take that early stance? Is it that because you heard of the Wuhan situation and you all said, you know what? Or is it just in terms of your forward planning, saying what are some of the possibilities and how do we, considering that there were SARS and there were odd MRSAs and other kind of viral diseases, is it that was part of your plan ahead? And so that was just in preparation and in keeping with your, say, strategic plan for the ministry and for the lab?
Over the past few years, we've been seeing a lot of emerging and re-emerging diseases. And so we knew that there was a need to be prepared. We went into that technology probably a year and a half before the COVID pandemic. And so we were also moving to a new facility, and we were looking to expand and be prepared for that kind of thing. So I think foresight and good planning was what put us in the position to be ready.
Indeed. That's just so wonderful. Hold the mic still because I'm coming back to you. But before I go further, I want to say that this panel discussion was organized by the Commonwealth Scholars Association, which is headed by Ms. Joanne George, and it consists of members, past scholars, who were blessed with scholarships from the Commonwealth, British Commonwealth scholars, the Commonwealth scholars. I am one of them. I was a recipient of a Commonwealth scholarship to pursue my PhD, for which I will be forever thankful. And so anything I can do to promote the work of the Commonwealth scholars, I am so happy to do so. In your presentation earlier, you said that you were tired and needed a break. What is needed to give you that break that you all need?
I think we need to see a decrease in the number of cases worldwide, not just in Dominica, because persons on the outside come to Dominica.
Yes, because we are doing so well. We have, the last I checked, there were only 14 active cases.
Exactly.
And I thought that was just tremendous. I saw there were no, it's like on most of these cases we have no community spread, no local transmission. And I mean, that means we are doing a great job. And for that, we must commend, the lab, the ministry, but also to the Dominicans who
Follow the protocols
in
for the
fact,
most part.
following the protocols in terms of the masking, the social distancing, the washing of hands, and so forth. But we're talking about what you need to give you a break.
Yeah, and we more importantly, at this time, we need the Dominican public to be receptive to the vaccine. This is what is going to ultimately get us out of this pandemic.
Okay, as you mentioned vaccine, I'm going to spin along to Nurse Mignon Roll Shillingford from the promotion unit, who I told you convinced one of the panelists to get to Monday to get her vaccine, and who has another one, the moderator, seriously thinking about what she has said. So Nurse Roll Shillingford, Mrs. Revere Gemot said vaccination is what is needed to provide a respite for the Ministry of Health and for us in Dominica.
Yes, most definitely, and I want to agree with Mrs. Catherine Revere Gemot on this. And of course, just speaking in terms of women, because we are on this platform because of women, we know that our nurses are predominantly females and women, and they have been, at the forefront. They are actually our soldiers leading the fight in this. And they too are tired. We have had to, at the Ministry of Health and as nurses, accommodate a number of new departments, being opened or commissioned, meaning we now have an isolation unit, isolation ward at St. James in Portsmouth, and also at the Princess or the Dominica China Friendship Hospital. We have now the quarantine unit that our nurses, for the greater part, are managing. We also have a hotline unit, a COVID hotline unit, that of course persons can call to get clarifications, to get directions, as to what to do. And even now, as we are having our COVID vaccine implementation being rolled out, it is now at 24/7. So that means that if anything is happening to you at 3 o'clock in the morning after you have taken the vaccine, there is someone who is up waiting to hear, how I can help you. And I think that is very good. But we have been going at this since last year. And as Mrs. Gemot said, we have been going at it since before. Because the other thing is that, and I was glad she said that in terms of her preparation, since before that we had this COVID-19, we knew also in terms of Health Promotion Unit that flu season was also upon us at this time. So even before we had our first COVID-19 case, and that's before Carnival, right, 2020, February, January, the Health Promotion Unit was already out and had done sessions on flu at every single primary school and daycare and preschool in Dominica, right? Because we knew already it was flu season, and in terms of respiratory condition, the modus of transmission, meaning how it spread, respiratory droplets, is the same, so the hand hygiene and exercising proper respiratory etiquette, all of this. So with all what I have said, Ms. Henry, yes, we need to get to a point that transmission is halting. And the way that we can do that is to have what we call herd immunity, or we can even say population immunity. When most of our persons are immunized or have an immunity against this virus, the ability for it to spread, to be transmitted, will significantly decrease. And some of the things that we are concerned about in terms of new strains and variants, you must have continual replication. You must have people continually passing on the virus for it to have mutations. So mutations occur because continuously it spread from person to person, and as they spread, they adapt and they change. Right? So it must have that. COVID-19 also must have a host. We are the host, us humans, to hold the infection to transmit to someone else. So for me to get a rest, I work every day, every single day. As a woman, I also have other responsibilities in my family life, my spiritual life, you know. As a professional, also my mother, who is 81 years old, you know. So I too need a break. And I must say, I still want to tell the public of Dominica that thank you for what you have done this far. Thank you for listening to us and complying or adhering with the protocols. I know it has been hard, but we want to say thank you. But it doesn't stop here. The next part of this whole strategic process and response to COVID-19 is vaccination.
Okay, and you said population immunity, herd immunity, and I understand you needed 70% of the population to be minimum in order to achieve that herd immunity. But it also looks like Dominicans are responding well to the vaccination, because the last report I saw, something like 8,000, and I think that was as of Wednesday or Thursday.
Well, as of yesterday, we are over
11,000, right?
Yes.
Yes, and so we are well on our way we have exceeded 10, so we need about 7. Let us take our population is at 70%. So 7 by 7, we did 49,000 people.
Yes.
Thereabouts.
Yes.
So Dominicans, 49,000 of us are needed. 11,000 have already been vaccinated, and so we need 38,000 more Dominicans to get on board so that we can have herd immunity and provide a respite, some respite. It may not be full respite, but some respite to the lab workers, to the nurses, to the doctors. And because we also have a significant number of our doctors are also females, female women doctors.
Yes.
But even the men doctors need a little respite too, because they've been working really hard, all healthcare workers, the frontline workers. And it's not just, the healthcare workers, because what we saw too in terms of COVID-19, I think it brought out even to the fore the importance of some jobs that we maybe didn't consider important or we looked down upon. The security officers, the supermarket employees, because without that supermarket being open, the pharmacies, those are the persons who were right there on the front line. And I say in my field of work, the HR professionals, we are the front line of the organizations. Because as organizations had to change and to get ready for remote work, who were the persons charged with that? It was the HR professionals. As we are now even grappling with the issue of vaccine, is it mandatory? Can it be made mandatory? Can you dismiss a person because they refuse to be vaccinated? And all of those are the issues. Who has to provide the guidance? The HR professionals. And again, like you show in the nursing profession, in education, because again, who at the front line too of teaching, mainly we female women teachers. We see again women in leadership. And how do we, so I'm going to ask each of you, how do we as women, what role do we play or must we play to ensure there is equality in the future, even in this COVID-19 era? One of the things I say is that we cannot go back to pre-COVID. The world has forever been changed. We can no longer go back to our modus operandi. Because as you rightly said, Luz, when you're giving your own experience, before COVID-19, you too were maybe a little laid back on moving to an online platform. Many persons were resistant. I remember having a consultancy, and in 2018 I recommended to the organization that they should consider remote work. If not for all the employees, for some of the employees, I identified the departments, and if not for 5 days a week, 2 days, 3 days a week. And that recommendation was dismissed of the board. One person even asked me after the presentation if I was crazy, if I was like out of my mind. And then 2020 showed up, and we had no choice. And in fact, I did call, and he said, "No, please don't say it." I said, "No, I'm not going to say it." But I said, "Do you realize how prepared you would have been had you accepted that recommendation?" And so a lot of organizations have to do so many changes. We cannot go back, even in terms of even VFA. As I said, remote work was not new to us. I mean, we worked remotely. I worked remotely maybe from the start. But it also changed our modus, because you still had clients, and you still have clients today who want to see you face to face, who want me to jump on a plane to come to them. And I'm like, no, I can do this remotely. And I remember I did a retreat for a board, and they were out of state. And they're like, "Are you coming?" I'm like, "No, I'm not coming. I'm not going to go into quarantine and come back." "Oh, no, that's not going to happen. It can be done." And they're like, "How?" "Because there's some group exercises." I said, "Yes, it can be done. Because through Zoom, I can see you, you can see me, we can interact with each other." And that thing went like a dream. And they said, "Oh my God." I said, "Yes, so you realize we can do the rest of the work that we need to do remotely." And so, what role do you see we as women? What role must we play in ensuring we have that equal world, in terms of equal opportunities for women, in terms of all the changes that COVID lead, but also too, because one of the things that the data reveal is that while, yes, remote world and remote work was wonderful, we also saw the increase in abuse and violence against women, against children. What role must we play to also minimize that in this COVID-19 world?
Well, I see this as an opportunity for women to rise up and continue the champion work that we have already started, taking up our roles as trailblazers in our capacity, as leaders in our profession, to continue doing and pioneering in our fields. And we need to continue doing whatever it is we were doing, but even at a higher level. For example, in the case to do with my institution, whereas I'm challenged with going 100% online, I still have to give the opportunity to people who would rather do face-to-face, and as a result, I've had to implement what is called blended learning. The blended learning is something that has been actually derived at this point here, because we have people who are refusing to go fully online, which is something we think would be best for us. Because during the lockdown, I enjoyed the remote management, because I was at home in my own comfort zone, and it was so nice that teachers actually came to my home on my porch. I did my transactions on my porch. I had one assistant in Roseau doing safety collection of funds and doing safety deposits at National Bank. I've had the opportunity to do banking with National Bank. I've had to go remote banking. I've had to establish organized systems with BTC to ensure that people can stay at their homes to make payment via mobile banking, via other means. I've had to champion everything, but I still had the challenges of people who couldn't. So I'm still implementing the blended approach in all systems in the organizations. Blended for the opportunities for people who are still not able to who are not able to have devices to be able to learn. So you have the opportunity where students who don't have access to internet, they still need to come in an environment where they can use the devices. So we have to remain physically open so that these students can take transportation, come to BTC office with their phones to be able to use our Wi-Fi. So we as women need to continue our champion roles in whatever capacity that we are doing, which is what we continue to implement at BTC, to ensure that we maintain that championship lead that we already have in the midst of COVID.
Yes, thank you very much. Of course, I want to continue on the trend Ms. Stedman was speaking in terms of that continued champion. And that word is very significant, being a champion. It has to be sustained because we know a lot of times if we need change, it is not a wham-bam situation. It may take years, it may take months, it may take weeks, but you have to be consistent with it. So consistency for me in terms of us women is one of the keys I would suggest. So don't support today and not tomorrow, or don't support today and 3 weeks or 4 weeks or a month, then you give up. You know that you have to continue until you get it done. And sometimes when we advocate on certain issues, and in this case in terms of women and having better outcomes with pandemics like this, you know, that affect them so much more. And yes, it affects women so much more. We know the roles that women play already in society, in terms of family, in terms of being the mother, being a wife, and still working. Because of the economy of the world today demands that women now leave their home and go out to work. You know, so yes. So we have to be consistent, you know, in this level, and new reasons for advocacy arises every time we advocate, you know. Then one other thing I'd just like to leave with us women is that sometimes we can be our worst enemy, each other, right? So we have to believe in the abilities of us women and give that level of support. Okay, so I want to say to all of my women out there, my Dominican women, whether it's in the medical or health profession and other, that I believe in you. I believe in each and every one of you. During this COVID pandemic and after we have dealt with this COVID pandemic, I know you can do it. I believe that every woman should work and should gain employment and should be educated, because studies have shown that if the woman in the home, the mother, is well educated, it will speak volumes to the children. Okay? So I want to empower you and empower all women that everything you have been doing for this COVID-19 that has been good, because we have had some very positive impacts, you know, that you to continue, you know, to doing that.
I want to look at the collaborative work we've done as women, because during this pandemic we saw that probably 80% of the frontline workers were women. And from just our local setting, I'll tell you what worked well: collaboration, not competition. That really helped us. We began to understand what it meant to work as a team. I had not worked with Mignon before. You know, we'd done probably very limited work together. And during this pandemic, we were just thrown at each other. And so she'd be calling me, I need you to do that. And, you know, I'd be calling her, I need you to advertise this for me. And that just worked so well. So I think this is one of the things that we have to take as women. A lot of times we feel that we need to be competing. But the collaborative work, it really, really works, and that the pandemic has shown us that this is how we move forward. We can move forward as a group, we can move forward individually through a collaborative process. The other thing is, in terms of the younger persons, the young women, I saw an opportunity for them to move on, for them to go to challenge their skills. Because the persons who learned this new skill, new technique in doing PCR, right now they're very marketable. You find other labs are calling them, do you want to come and work with us? You know? And sometimes we see things as probably a punishment or more work. Any opportunity for learning, for developing a skill, we need to embrace that. Because you never know where it's going to take you. And that's what I want to do.
Oh, I just love the points that you made. And that last point you made is something I've always said, you know. I say to persons, because, you know, in my work, you go out and persons like, oh, that's not on my job description. Oh, I said, listen to me. If I had to worry about my job description, I would not be where I am. I'll tell anybody that. I went to ECCB as an investment officer. And I told them, the job description said about managing money and whatever. I told them it had to be more, at least 2 years before I manage any real kind of money. I did so much other work in part of the team that restructured the investment unit. I did all of those things. And what happened? That skill came back to meet me when I went out on my own, going out to review, because you now knew what to do. Even when I was the coordinator of ARP in Dominica, Administrative Reform Program, so many things. And always, this is just like stepping stone toward your future, making you more marketable. And I do know you have done a fantastic job at the lab, because I do know of places, of labs outside of Dominica that have recruited from Dominica and who are reporting nothing but positive work in terms of their initiative, in terms of their willingness to go over and above the call of duty to ensure that right now everything is a PCR test. The PCR test results are done and done accurately and on time, because they recognize that people need them to either get out of quarantine, because there's a cost for quarantine and things like that. And so that is just excellent. And so when we note too that, and a few maybe months ago, there were these things going around with all of the leaders. In fact, how they call it, the anecdotal results show, or maybe even the real results show, that the countries headed by women have had the greatest success in the containment of the COVID-19 pandemic. And they noted some of the countries: Denmark, Ethiopia, Finland, Germany, Iceland, New Zealand, Slovakia, and I added our Barbados. When I saw it going around, I said, but they're missing Barbados. And right now, yes, Barbados is in a not so happy place, and we can all talk about that. But one of the things I always say we do, when somebody is going on a down, we forget the time when they did well. And so while, yes, right now Barbados is really, and there are many reasons, I mean, that's not what we're here for. But in the early part of COVID-19, Barbados had to have been ranked as one of the countries where that was well contained. And so I don't think somebody's accolade should be denied just because the future took it away. And so what do you think are the qualities or the reasons why these countries headed by women, what's special? What is it that women bring in leadership that make us so successful? Because it's not just in leaders. I mean, the HR studies also show that women leaders are some of the better leaders in terms of performance, financial performance, but in terms too of engagement of highly engaged and motivated workers. Women leaders have one of the highest success rates. What about women? What about us?
So one of the things Ms. Stedman passed me the mic. Okay, so one of the things I think is our ability to multitask. I think that is one of the most significant. The ability, and not just multitask, and doing different things or getting different things done simultaneously, but still doing them at a high quality. So there's that thing in terms of women and the ability to do multiple things. And a terminology, a new word that I have developed since this COVID-19 is octopusing. So I have been using this word ad lib since this pandemic. I know some of your viewers may be laughing because they have heard me use it to them. Hi, Mrs. Shingford, how are you doing? Octopusing. But it's not just about using different arms or tentacles in the case of an octopus, but also doing it to that level of standard to get it done, right? So I think women are very good in that level of multitasking or octopusing, my terminology. And also there is that element of caring and nurturing. Although sometimes to a very great extent, and I saw that I had to do this within these pandemics a lot, remove that care and worry about if the person had money or if they had children, and strictly stick to the science of things. And I will tell you what I mean. To enter Dominica, the protocols to enter Dominica if you're coming from a high-risk country, was that you would have to have a PCR test at least within 72 hours. And you would have to go to a quarantine that is certified by the government of Dominica and the Ministry of Health. And we know there were persons out there who wanted to come in, but they would say they cannot get, or it's difficult for them to get a PCR that does not expire after 72. But I could not think, oh boy, I'm sorry, because that sorry would have increased cases in Dominica. So I had to stick to the science. You understand? So while we are very compassionate and caring and have that nurturing, we also able to identify when we should not let down our guard, or in that case, not stick to the science. So I would say those two qualities, the ability to multitask, but not just multitask, but multitask and do it well, right? And also our nature, right? In terms of this.
I would like to add to that resilience, strength, and stamina. And I think that is something that was given to us by God. The fact that we are childbearers, we withstand a lot of pain, pressure. So it's a natural gifting in women to be able to handle things, but the icing on top of that is the ability to do it well and want to see it well, bring it to fruition so that it's top-notch in the end. So I think this is one of the contributions I wanted to make, that women are generally really resilient, and we won't stop until we see everything happen really well. And the fact that we are also meticulous, adding to being multitaskers, some of us women are very easily responsive to disasters. For example, in my case as a woman, and I've seen many women like that, how quickly can you respond to an approaching disaster? Women are like that. We see things ahead of time, we start our planning, just like how we do with our homes. So your ability to bounce back quickly, to make plans quickly, so that when that thing hit, you will be able to stand up. In my case, I saw things coming, I planned and I responded quickly, and I was able to ride with it at the time. You know, I often tell my students about when the going gets tough, the tough get going. I'm a person, I have some great foresight that I give credence to God for. I don't just sit back and waste my God-given time on the earth to do things that most people do. As a manager, I do a lot of forecasting, and I'm a high visioneer, I must say. I look at things and I actually try to forecast what will happen in the future, and I start putting systems in place. So what if? So even for disasters, I was able to bounce back, because my building, I had to get out of my building, move into a smaller space, because I knew population was going to drop. I knew that the school would not be able to withstand the financial burden of a property. So I had to do the sacrifice, which is a bonus, because at the end of the day, I'm a businesswoman. I'm a spearheader, and I was able to respond quickly. So that, I call that resilience in a woman, because perhaps the average person would have just given up and go under, and perhaps because some people actually wonder if BTC is still existing. Somebody wrote on Facebook, I cannot believe BTC is still existing, because most people think that after all that, how is the school still surviving? And right now, all I can say is the biggest and the best part for BTC. All I'm seeing that the school is going to do well. So that level of resilience, I think, is a God-given gift to women that I have.
How old is BTC?
Oh, man. Well, we are in operation for about 20 years now, I can probably say, yes.
I want to agree with the other panelists, but I also think that in a male-dominated environment, we have something to prove. We need to prove that we can do it. We can do it just as well. We can do it better. And we kind of, sometimes we shortchange ourselves, and we try to, put ourselves in a corner, not somebody put us in a corner. So I think just noting that I'm a woman, I can do it, I have the God-given talent to do it, and I'm going to go out there and do it. It's so much about believing in yourself. when Mignon spoke about multitasking, that's what we do at work every living day. We multitask. Critical path, this is something like, it's just ingrained into our lab technologies. You have to know the critical paths. And I look at my husband sometimes in the house, and he's doing something, and I'm saying, but why is he doing it like that? It's going to take a shorter time. And it's itching for me to go and do it, because I know I can take a different path that will get it done in less than no time, And so I think, I also think the nurturing aspect of the woman, also it brings a lot across to others and really draws people to us.
You said something, Mrs. Gemot, that in a male-dominated world, women think that we have to do better in order to stay to shine. Don't you think that is added pressure onto women and may sometimes have the reverse effect?
It does, and it can have. But I also think that it is what it is. It's a male-dominated world. We know that it's a male-dominated world. And people look to us. I want to see if she can do it. I'm sure she can't do it. And so we have to be able to believe in ourselves.
Okay, that's it.
We have to be able to believe in ourselves. And it comes out like I have something to prove. But it's all about the belief in yourself.
Indeed, and that's one of the things I always say. For me, I seldom look at people ask me what my competition is. That competition where I'm sure there is. Maybe something, but for me, it is, as you said, believe that whatever it is I'm called to do, I can do, and I can do it excellently. And always my thing is to do better than what I did yesterday, because I tell myself always, no matter how good you are, no matter how great you are, or others think you are, or you think you are, there's always something you can do better. And so the quest is to find what is that better and to do better each and every day. And I think if that's the approach, I think that's maybe the approach most women have, because as you said about the multitasking, think of us at home as mothers, caregivers, cooks, cleaners, washers, ironers, educators, everything. I tell you right now, I don't have a helper and I'm going half. I don't know how women do it, because I find myself this washing dishes I never liked to do as a child, and I still don't really like to do as an adult. And when I'm cooking, I maybe, as they say, I maybe empty every spoon, every knife, every fork, everything, because every time I'm looking for a spoon, I take a different one, and so forth and so on. Then I'm stuck with a mountain load of dishes. And after you finish all of that, and you have to check homework, you have to do this, it must work. Voila. I think, as Lucia said, God gave us ability to do.
Yes, that is so correct. And I am so liking what you are saying, Dr. Henry. My greatest challenge is myself. And just as I speak to and empower, which is very significant to be empowered in this, is that I lead to empower the staff that I work with, which are predominant females. I think I only have two males, working with me. I always tell them, success, the way we view success in this world is not gauged based on someone else. It's based on yourself. What you can achieve and if you are achieving it. Right? So the star's limit is different for me and different for you. Yeah. Okay, so do not gauge your success on what someone else has done, and especially as women, but what you are able to do and if you are doing it. During this pandemic, I came up with a new phrase to empower, and based on what I was seeing in terms of when we speak in terms of doing the work and doing it well and not doing based on what you're being paid. It is your will must be stronger than your skill. Okay? You will need to want to. You want to feel to, go to. And you see that skill, it will come. You can be the best lab technician, the best health promotion specialist, and you are not using that skill to have an impact. It will go nowhere. But if you have someone who is willing to go the extra mile, the skill you have, they will get that too and even surpass. Okay? So women, continue to have your will, being stronger than your skill. And you know what else? Do all for the glory of God. all for his honor and glory, and not for man. That way, we will never sit and say, all that I do for you, all that I do for them, or I am not doing that for you because you're not appreciating, but you do it for him. And you know for Christ, gratitude is a must.
Indeed, and that is so right. As you were saying that, it reminded me of my father, because that's one of the things my father always said to us, that you do what you are called to do. You don't do it for accolades, you don't do it for recognition, you don't do it for reward. Because if that's what you're waiting on, if you don't get it, then what happens? You don't do it? No, you have to do what it is you're called to do. What is your vocation? And then you have no choice but to do so. And I think as women, our vocation is so many things. And as one of the things Steinberg Henry had said many, many years ago when I was promoting maybe the first Phenomenal Caribbean Women's Symposium, he had said, women, we are truly the nurturers of a nation. And when you think about it in all ways, I think that is the underlying underscoring of us in whatever field we find. So yes, Luz?
I was just going to add,
Yes.
my colleague, she mentioned about God. I speak to people every day, freely now, because of the task that I have in my job. I tell people the word of God speaks to us in our job every day. Whatsoever the least you do to my brothers, that you do unto me. So to me, our job as women is really a call from God. What we are doing is a vocation. It's a job that we are doing in response to the directive from God. So that is why some of us do it with passion, because as a woman, if I had to look at the other aspects of life, I would not be working in my field. Perhaps I would enjoy a greater life. So I see my role as something that I want to contribute and make an impact on people's life for the betterment. It's fulfilling to me. It brings me joy and happiness. I enjoy doing it because I know that the people whom show up on the doorstep at BTC are people who God chose to send, because He wants me to impart. He's using me to assist them. So everybody, I give Him thanks every day. They are not just customers. So often when a person would come out and say, Father God, you sent this one, let me see how and what is it you want me to do with this one. So I enjoy my job as a vocation, a task, God-given task. And that's why I think I'm doing it well. So I still want to say something. I'm very happy to have met Mrs. Shillingford because of what I discovered. And I want to say publicly, as a woman, I was afraid to participate in the vaccination. I choose to say that now because I am now convinced that I can take the vaccine. I was resistant because I felt that I am going to allow everybody else to take it, to see what comes out of it and get the feedback from those who take it. I'm a person who likes to stay at the back. I don't like to rush up front. But after speaking to Mrs. Shillingford, I'm discovering that I should actually rush to get the vaccine. I am more convinced, having met you, I want to say that I'm very, very pleased that I met you and that you were able to convince me to take the vaccine. And I want to take the opportunity to ask all those who are listening to me via this medium, I'm going to encourage everybody to get vaccinated and so that we can reach herd immunity. I'm going to promise you that I will do everything in my capacity as a business person to encourage everyone that I meet to get vaccinated as well.
Wonderful.
Lucia, we are so happy to hear that. I mean, this is the kind of reward that you get out of the work that we do. I mean, it has been late hours, but when I hear Lucia speak, I can say, we've done our work well, Lucia, and I really hope that you go out there and really encourage others to participate, because we need to reach herd immunity. In terms of the same encouragement, there are a lot of conspiracy theories out in the world, and we understand that people will have reservations in terms of getting vaccinated. This is a normal thing. So we don't want people to feel that, it's abnormal, that you have questions, you have concerns. but the evidence is out there that it's been working. We see other nations where people have gotten vaccinated, the number of cases have gone down, and this is what we're looking to do in Dominica. So, Lucia, thanks for coming on board.
Okay, so ladies, we have to wrap up. So I'm giving you 1 minute each to your last words as we reflect on the theme for International Women's Day 2021, Women in Leadership, Achieving an Equal Future in a COVID-19 Pandemic. And we really want to thank the Commonwealth Scholars Association for pulling together this panel discussion and having such an interesting discussion.
Okay, so I just want to say to all women to continue to push forward and strive, and remember your biggest competition is yourself, and success should be judged based on you yourself. Ensure that your abilities, that you can reach to the highest height of your ability and what you can do. There are some of us who will never reach the ability of what, or the achievement of what Dr. Henry has achieved, or what Mrs. Jemmett, Katharina Riviere Jemmett has achieved. But there are things that we can achieve and be successful within our own abilities. Okay, I also want to say to continue to advocate and speak up for equal rights for women, especially in the working world and payment. If you employ me as a woman to do a job, and I do it just as well as a man, I should be paid the same and respected the same. So go out there and be the diamonds that you are.
Well, to all the women out there, I would like to encourage women who are listening to me today to continue to be champions in your capacity, in your field, in your vocation. Believe in yourself and continue to do the good job that you are already doing. Continue to champion the cause and strive to higher heights. I have a slogan that says, soaring to higher heights. Believe in yourself so strong that whatever you are doing, try to achieve something greater. Every year, look back on your previous, see what is it you have done, and try to see what you can do better in the years to come. And whilst you are doing that, always remember that whoever you get in contact with, remember that this person is sent by God, and your work that you are doing should reflect any good for humanity. So if you are involved in humanity, think of the work that you are doing it for the cause of God, that whatsoever you do to the least of my brothers, that you do unto me. So says the word. So I want to encourage women to continue to be resilient, continue to be champions, and continue to change the world, even though we could be seen as trying to take over. Some of us are humble. Remain humble and still try to champion your cause.
I want to target women in science. We see that as a field that probably we consider to have been male dominated, but we see more and more women getting into science. And I want to say Happy International Women's Scientific Day, because science is very important at this time whilst we deal with COVID-19. I want to tell you to rise to the highest of the profession that you can. Be confident, be comfortable in your own skin and your own field, and you'll take this thing forward.
Ladies, thank you so very much. That was a wonderful discussion. I wish I could stay here for another hour or so, but we gotta go. And so, as just a wrap up on that theme, and just echoing some of what has been said, one of the things I say to my son every day, you are enough. And so, women, I want to leave you with that message that you are enough. And once you believe that you are enough, then there is no competition with others. You are enough to be the best that you are called to be. Each and every one of us formed in the image of God. He knew us, named us even before we were formed. And that knowledge has to be enough to keep us secure in ourselves. No matter what field we are in, no matter where we are. And as we speak about an equal future in this COVID-19 world, it's an equal future not just in terms of our professional life, where we advocate and we champion for equal work, equal pay, equal access, because access is so critical to education, to job opportunities, to work opportunities, to be our best selves. But I want us to also pay attention to equal opportunities to live a peaceful, violence-free world. As I noted earlier and as the research shows, violence against women and particularly children are on the rise. And we women, we are the nurturers. And so one of our key jobs is the protection of our children. And as women in that COVID-19 world, to ensure a safe space for ourselves and for our children. And sometimes it will call for us to go outside of our comfort zone. Because we worry sometimes, where will I get money for food? Where will I get money for rent? Where will I get money to sustain ourselves? I say to you, you are enough. There will be the opportunity, because at the end of the day, life, once there is life, there will be an opportunity for those things. Because we stay in that unsafe space. And we saw earlier in Dominica, and I'm sure around the world we can find other examples that replicated it. We started off the year in Dominica with 2 gruesome murders against women. Unsafe. And so what could be more unsafe than losing your life? And if you have children, leaving them to the care of others. So women, I say to you, rise up. And whatever space we are in, to use our voice, to work collaboratively, to work consistently, and to work with that passion that we are called upon to make a positive difference in the lives, not just of our own families and ourselves, but in the lives of others. For as Lucy has said on more than one occasion during this discourse, whatsoever we do to the least of our brothers, we do it not for ourselves, but as Nurse Mignon said to us so well, we do it for God's glory. And as Mrs. Jemmott has said to us, to just be our best selves. So we thank the Commonwealth Scholars Association for this opportunity to be here with you on International Women's Day 2021. Women, go out there and make that difference. Be the leaders of your homes and the leaders in your communities. Good day, bless you, and may God always keep us in the palm of His hands. Amen.